Good morning, good evening, good afternoon. This is Dr. Garais, BIO116, Anatomy and Physiology 2. And this is Unit 3 of Laboratory. And we are going through 3 items today, which is your male reproductive, female reproductive, non-pregnant, and renal, which is the kidney, or the internal structures of the kidney. So here is, of course, the kidney, right? And the hilum is the indentation here. And of course, renal artery, renal vein go through here. And what exits also is your ureter. The ureters then pass into your urinary bladder right here, goes through the urinary bladder and through your, why does it do that? Sorry at my frustration because this is the third take. Maybe I shouldn't use the pen. Just use my finger, I guess. Okay. So right there, right, urinary bladder. The bulbourethral glands here, I failed to mention. See those little tiny little like pea-like structures right there? Right? And of course this big structure here is your prostate. Here's your seminal vesicle, right? Of course, fascia of the penis, at the base of the penis going into the shaft, and then the glans penis, which is up top here. Okay? Let's remove the covering of the testes. Okay? You could see here, there are 2. Okay? And the epididymis, testes, of course, epididymis is here, connected into the vas deferens, right? And then you'll see the vas deferens rolls around into here, okay? Also known as your ductus deferens, then goes to go through the seminal vesicle, then, of course, through the prostate. Let us also now look at the shaft of the penis. Give me a second. Let me cut it up here. If you look here, you have, let's make this a little larger. You have the corpus cavernosum, there's 2 of them, and that is the erectile tissue. Again, it responds to parasympathetic nervous system innervation, release of nitrous oxide, increased flow, decreased blood pressure. And then of course here, the corpus spongiosum, here in the bottom of it, right? And that will, it's also erectile tissue, but not as potent as the corpora cavernosa, and its function is to house the urethra. Okay? And those are the structure of the male. Here's the female. Let's go through the ligaments first. Of course, the broad ligament covers the uterus, ovaries, and the fallopian tubes. Let's remove those. And now exposing uterus, ovaries, fallopian tubes. This area here, infundibulum. The fimbriae are in there, but me personally, I've never witnessed the finger-like projections of your fallopian tubes. So that's your fallopian tube, and it's going to connect into here, the uterus. Okay. Now the other ligaments will be this, your suspensory, which is going to hold up the ovary here. Round ligament. This one right here. There you go. Tap it a million times. There you go. That's the round ligament. Okay, you get 2 of them. Cardinal ligament on the side. If you look at here, this is the anterior here, posterior here. This is your uterosacral in the back, and then in the front, your pubovesicle. You have external structures, your labia majora and minora, and here highlight of your clitoris, which is inside your labia minora. Vaginal canal. Okay. Now, when we're looking at the uterus, the top part is called the fundus. The main body is called the corpus. And of course, this area right here, where it slims down and connects into the vaginal canal, that is your cervix. Now, the one thing you'll also notice is this marbling of the uterus and the vaginal canal, which signals smooth muscle. Okay. Now, let's take, of course, let's cut it. And let's label these structures. The outer structure is your perimetrium, and this is the uterus, the body of the uterus. Perimetrium, and then the majority of it is, you see that marbling muscle pattern? That's your myometrium. And then on the inside, see this little line here? And that's the one that was, the delicate inner lining, and that is your endometrium, and that's the lining that gets shed during your menstrual cycle. And that is also the lining that also proliferates during pregnancy. Okay. And last but not least, this is your kidney. Okay. And let's now draw some arrows. Okay. Here is your cortex. It's the very outside or the outer rim. Let's look at some medullary structures. Renal pyramid. See this part here? Minor calyx. And then going into a major calyx. And then this area right here where all the major calyces will start to meet, that's your renal pelvis. Okay? Not a lot in the cortical structures on this arrow right here, but of course, the subsequent arrows from second, third, and fourth arrow, that is your renal pyramid. Then this arrow right here, that is your minor calyx. This arrow right here, major calyx, and this big yellow oval, that's your renal pelvis. Renal pelvis will be part of your hilum, which is this area right here. And the hilum has three structures, which we really can't differentiate right here: renal artery, renal vein, and your ureter. Okay, you see this little like skin-like stuff here on the outside, here this as well. That is resected or dissected parts of your renal fascia and your renal capsule as well. Okay, which are two of the several things that protect this thing right here. Okay, and if you look alongside here, we color it in blue. Do you see all these like kind of white areas in between the renal pyramids? Those are called renal columns. Okay? All right. Hope you enjoyed this video. Have any questions? Shoot me an email.